Well, hello, everyone. Welcome. Thank you for joining us today. My name is Stephanie Tapscott, and on behalf of the Southeast MHTTC, I'd like to welcome you to our four-part series, in an introduction to ACT. We're going to work on that today with Dr. Waford, who will be facilitating the 4 sessions. Today's session, she'll provide an introduction to the framework. So without further ado, let me go ahead and introduce you to Dr. Waford. Sorry about that. Dr. Waford is a board-certified licensed clinical psychologist. Her clinical expertise falls in the area of mental health intervention and prevention for individuals with first episode psychosis, schizophrenia spectrum disorders, and bipolar disorders. In addition to clinical service, she is involved in community education and advocacy for individuals living with severe and persistent mental health challenges. She is a jointly appointed assistant professor in the Hubert Department of Global Health at the Rollins School of Public Health here in Emory University. Dr. Waford's clinical research work has focused primarily on mental health disparities in underserved and oppressed populations. She has significant work experience with culturally appropriate assessment tools for these and other global communities. Her work has included investigating long-term predictors of well-being, health, and social capital in adulthood, and understanding structural and systemic resources and barriers that moderate recovery for individuals with lived experience. Dr. Waford, we're just so overjoyed to have you come and share about ACT today. Thank you so much.
Yeah, thank you for having me. I'm going to go ahead and share my screen. As Stephanie said, I wear a few different hats, but I'm certainly here today to talk to you about my work as a clinician. And I'm really excited I always welcome the opportunity to talk about acceptance and commitment therapy, or ACT. It's the primary orientation that I use in my own practice. And so really excited to talk to you about that starting today and then over the 3 sessions that are following today. There we go. So this is, as Stephanie mentioned, this is part of a 4-part series. And if you are attending all 4 parts, or you're considering attending all 4 parts, this just gives you an overview of what I hope you'll get out of those 4 different experiences. And you may have seen these objectives before, but wanted to just highlight those again today, especially if you're considering whether or not it's something you're planning to do, but certainly would welcome all of you all to do that. Today, we're going to be focusing on an introduction to the ACT framework. So I'll be talking about the core processes of ACT. I'll be discussing how ACT is similar to and different from other interventions that we may have all been trained to utilize and may also practice. Give you some interventions so that and some activities that you might be able to use, especially in the early stages of therapy, as well as discuss sort of one of the, not one of the main 6 processes of ACT, but an additional process that's often used called Creative Hopelessness. And then also thinking about initiating therapy with ACT, as well as ACT case conceptualization. Some people might be learning ACT for the first time today or getting the first introduction. And so allowing you to think about, how do I start ACT with a new client? Or if I'm really thinking about wanting to incorporate more ACT principles, what are some ways to start having that conversation, maybe with some ongoing clients? I am going to stop throughout the conversation today just to check in if you have questions or need some clarification. Stephanie's also going to be monitoring the chat. So if you do have questions, feel free to throw them in there. And then when I pause, we'll take a look at those. Or Stephanie's also going to let me know if it feels like I've just kind of breezed over some really important questions and need to pause. Really hoping we'll get to everything that we've got on deck today, but really want to prioritize any questions that you have. I know that many of you sent questions in advance of the session today, and I have those in mind as well as we get started. So let's talk about, well, actually, before I get started, I'll say one more thing, that I'm talking about ACT as kind of a primary framework that I use. I do think of myself, as many of you all might, as an integrative clinician, meaning that I utilize a lot of different elements based on what might be most helpful for the clients that I see. But this is a primary framework that I use. and just excited about how to talk about how to use that together. So what is ACT? So ACT, or acceptance and commitment therapy, is part of what we call the third wave psychotherapy approaches, along with DBT and other mindfulness-based therapies like MBSR or other therapies that have a more of a formal mindfulness component. So we think about sort of the history of therapies, and this is certainly not all inclusive, but we think about starting with psychodynamic psychotherapy, then moving into behaviorist or behaviorism orientations, then moving into more cognitive processing therapies, or cognitive therapies. We're thinking about thoughts, paying attention to more than just behaviors, but also thoughts. And then in this third wave, it really includes this more reflective practice and incorporating some additional components like mindfulness, like observation, like values in a more intentional way. And there's an overarching objective in ACT, and that is psychological flexibility. So in all the processes that I'll talk about today and that we'll really break down in more detail in the following sessions after today, are all about opening up the options for how someone can get to where they ultimately want to land in their life. So if we think about how someone wants to live their life, we want to open up the avenues in how someone gets there, inviting people to think about this question of, if there is a place or a way that I want to experience my life, am I open to additional options than what I have been considering, even if they're new, they're different, they're slower, they're uncertain, they're a little clunkier. But if it opens up the routes to get there, am I open to considering those? So that's kind of the idea of flexibility. And you'll find that in all of the processes that we talk about, all of the activities and the framework itself, there are two main goals that we're focusing on. The first is developing a values-guided life. Is someone able to identify who they want to be in this life, what they want to embody, how they want to experience their relationships, their work, their day-to-day activities, when things are going well and when things aren't going well? How do they want to do this life? The other main goal is learning how to relate differently to whatever it is that they're experiencing internally and externally, so that connection with that values guided life, or moving toward that values guided life, seems more accessible. So I know this probably feels pretty simple or oversimplified, that there's sort of two main goals, but as we kind of walk through some of the processes today in the framework of ACT, you might notice that we always come back to this. It's about, what is the life that I want to live, and who do I want to be in that life? And how can I engage differently with what's happening to me inside and outside, so that I always stay connected to that life that I'm trying to live? So for those of you who have some experience with ACT, then you may have recognized either the term, the hexaflex, or have seen a picture like this before. But this is called the ACT hexaflex, which is meant to demonstrate the components of that idea of psychological flexibility. There are 6 components of ACT, and at any point in time, you can be working on any one of these processes or experiences with your client. What's really cool about ACT is ACT in itself is flexible, meaning you can start anywhere in your first session, and the idea is that the more that you practice, that you yourself feel pretty flexible in what you work on from session to session. So it's not procedural in the way that we might think CBT might be a bit more procedural, in terms of like what you start with, and then moving toward more scaffolded learning or adding in additional skills. And there's some other orientations that have a similar kind of procedure. This is really meant to, some ACT practitioners or ACT, I guess, creators have this idea of like being able to dance around the hexaflex, that you can sort of move pretty fluidly depending on what your client might need in that moment, or what their particular issue is. And I'm going to break this down a little bit today, but more in depth in these next 3 sessions. So this is what psychological flexibility looks like, but often our clients are coming in because they're stuck in one or more of these 6 areas. So in red, you can kind of see here some, kind of brief descriptions of what psychological rigidity might look like. So if we're asking or hoping that someone can have contact with the present moment, meaning they can exist in the here and now, not then and not there, So not be operating now based on past experiences or what they're hoping will happen in the future, then people have kind of the most control and power in the present. But we often find, and we might even find this in ourselves, sometimes that we can get stuck. We can get stuck there, and we can get, or stuck then, I should say, and stuck there, past and future. We might also find that when we think about that values guided life, that people don't really know what that is, that they're unclear what it is that they care about, or it's unclear what's really meaningful, or there's maybe some confusion around what are my values and the things that I care about, and maybe what's been, and how is it different from maybe what's been imparted on me by, let's say, parents or other respected people in someone's life, or by faith or something like that. Being able to really take ownership of one's own definition of meaning and value. But sometimes people are unsure what that is, and so they're operating in ways that may not be consistent with what is meaningful to them. People may also find that while they understand what's meaningful, they understand what's important, they're unsure how to actually execute steps to get closer to that. So they may value connection, they may value love, they may value creativity or spirituality, but the steps that actually allow them to connect with that either are unclear or aren't happening, and they feel stuck in that way. I'm going to kind of finish going around the hexaflex just to talk a little bit about those flexible processes and the kind of rigid version of those, but knowing that we'll go into more detail a little bit today, but then breaking these out in the next 3 sessions. So self as context is this idea as seeing ourselves as sort of a vehicle that can kind of hold what happens to us. I always find it a little bit difficult to describe this one, but we might be able to think of it as an easier way to think about it is actually talking about it from the rigid way. So there's a difference in self as context, which is what we would like to see for ourselves and others, and self as content, which is being defined by what's happening to us. So self as content might be something like, I am bad, or I am flawed, or I am depressed, versus self as context, which is, I am a person who right now in this moment is feeling sad, or feeling bad, or feeling depressed. And so we can imagine how people can get stuck in that content about themselves, and we want to help people move toward context. I am experiencing something right now in the present moment, and there's also this bigger, more dynamic part of myself as well, with other things that I can identify with in addition to. The last 2 processes are diffusion and acceptance. So diffusion is this idea of being able to look, watch, observe with curiosity what is happening to us on the inside, our thoughts and our feelings, and being able to just identify them as thoughts and feelings without too strong of an attachment, without accepting them as truth or facts, and really being able to diffuse. The sort of rigid form of this process is fusion. So fusing with, that's something that's happening in my mind. If I'm thinking it, then it must be real, must be true, I must need to act on it. And we can all probably think of versions of that within ourselves and with our clients. And ACT really focuses in this process on helping people be able to name their thoughts and feelings, and then decide if that is something that they want to take on or spend more time with or give attention to, or if it's something they just kind of want to notice and leave it be. The last form here is acceptance. Acceptance is exactly what it sounds like, which is accepting what is. That can feel a little bit challenging for people to swallow, even myself. So in ACT, it's a really intentional definition of acceptance, which is accepting, again, just what is. And not because you like it, not because it's okay, and not because we want it, but because that is what's happening. And many of our clients may come in at different points or at the start of therapy, really stuck in avoidance. I want this to not be happening. I don't want to feel this way. I don't want my environment to be this way. I don't want this event to have happened, and be really stuck in that battle with trying to make something not happen that already is. And so ACT allows people with strategies and with a lot of compassion and empathy to open up to what is here and have a different relationship with it. You might remember that one of those main objectives or goals I mentioned before is that relationship, a difference in relationship. And you may have noticed in all of these processes, it's about relating differently to what's happening, to the present, to what matters to you, to steps and goals that might be important to take, to ideas that you might have about yourself, relating differently to your thoughts and feelings and what they mean and don't mean about you, and to the reality of what's showing up in this moment, internally and externally. So when we think about the hexaflex or the 6 processes, we can actually break them up into sort of 3 different, I guess, sections. And this is how the next 3 sessions after today will be broken up. So I'll talk next time about doing what matters and really diving in deep to values and committed action, what they mean and what strategies can be used in session to explore those. Then moving into being present, diving into contact with the present moment and self as context with different activities that we'll do together and understanding some kind of underlying processes there. And then opening up and diving into acceptance and diffusion. So today's a bit just of an overview of all of these processes, but if you'd like to learn more, that's what the next 3 sessions will really be offering. But let's do a bit more of that just for now. And so I've already talked about the hexaflex a little bit and those individual components, but if we're thinking about those 3 kind of, if we take those 6 and break them up into 3 processes, or I guess categorize them into 3 processes, we can think about what kinds of things we would like our clients to be able to achieve through the ACT framework. So doing what matters, and that includes those values and those committed action. So are our clients, or can this client be clear about and connected to what matters to them? Do they have an understanding of what they care about, what they want their life to look like, the kind of person they'd like to be and what they want to embody? Can they identify, take, and sustain values-guided actions? So actions that are in line with that. So let's say if a value that someone holds is connection, can they identify and take steps to connect in really specific ways to people and in places and environments that are important to them? In service of being present, we want to be observing if our clients are able to engage fully in the here and now experience, not at the sacrifice of the past or the future, because of course those are really important, very meaningful, and have a lot of really important information for us as clinicians to be able to help and serve our clients. But are they also able to, when it's important, to be in the here and now and make decisions and choices that are influenced by what's happening right now, and not necessarily by rules or experiences that happened before or that they worry may happen in the future? Can they observe with curiosity? So ACT is really big on this non-judgmental approach and curiosity. It's that mindfulness component. Mindfulness is being present in the here and now without judgment. And that can be done in any number of ways, as we'll talk about together. So is the client able to observe themselves with curiosity? What's happening around them and what's happening inside? And can they actually empathize and be compassionate with their own thoughts and feelings? That idea of the observer self might be familiar to some of you from some other orientations that you may use. And it's a similar idea here. Can we almost kind of step outside ourselves, or can our clients do that and notice, look at what I'm experiencing right now. What must that feel like for me? That must be really difficult. And I wonder what kind of impact it's having on me to experience that. And then thinking about opening up and those processes of acceptance and diffusion. Are our clients able to identify what they're experiencing and actually practice unhooking or detaching? So not operating as what we're feeling and what we're thinking is a truth or a fact, but embodying that curiosity from being present and from non-judgmental awareness, and take in the information of our thoughts and feelings, and still feel like we have the ability to choose what we want to do next based on what we truly value and not just what our mind is telling us or what our feelings are saying. And can we open up for whatever we're going to think and feel? Because it's happening anyway. It's showing up without permission. If we were ever asked if we wanted to think and feel things, we would all probably think and feel a lot of different things. But thoughts and feelings show up without asking, and we're kind of left to decide what to do. So can we give ourselves the space to know that that's going to happen and take the time to think about what matters to us, and or to help our clients do that, and then make choices that are based on what matters to us and not necessarily what has shown up inside or outside. Now, you may have noticed as I'm talking about this that all of these processes are really integrated and they really inform one another. That in order to practice acceptance, you have to know what you're accepting. You have to be able to observe it with curiosity in the present. In order to choose to unhook and not embrace our thoughts or our feelings as truths or facts, we have to first know what we want instead, or not what we want instead, but we have to know, like, why would I want to do that? Oh, it's because I want to live my life in a certain kind of way. And this thought and feeling, really embracing that, if it's unhelpful, doesn't allow me to live that life. So with that in mind, I am going to choose to sort of unhook or diffuse if it's not serving the journey toward the life that I'd like to see for myself. So let me pause here. This is a very overview of ACT and its processes. And I just want to see what questions anybody might have about that up to this point. Probably might be a lot of things on your mind, but happy to. Okay, well then I'll keep moving along. Again, there's a lot of information here. And so if anything, hopefully what we're talking about today helps you think about, is this something I'd want to learn more about if with the little taste that I'm getting today, and knowing that we'll be able to go more in depth with each of these processes in the coming sessions. So now that I've given you a little bit of an idea of the ACT framework, let me talk a little bit about what makes ACT, in my mind, different than other therapies. What really sets it apart, and why might you want to use ACT? Either adding ACT into your repertoire or suite of orientations or therapies that you use, or why you might want to embrace ACT a little bit more formally in your practice. I'll say too that when the things I'll be just talking about here quickly are not necessarily unique to ACT, because you might notice that in other orientations that you practice, DBT or IFS or other humanistic therapies or CBT, that these components, you find yourself practicing these same kind of components. But what I'm about to mention here, I find that ACT does very intentionally. And the creators of ACT are really deliberately talking about these principles that I'll be outlining for you here. The first, and in my mind, the most important, for me at least, is really embracing and being intentional about the discussion of suffering. That suffering happens, and that as human beings, we will suffer. And we will suffer every day in some form along a continuum, from horrific traumas and abuse and loss and genocide, to the experience of extreme depression or very tormenting delusions and hallucinations, to frustrations with our partners, to sitting in Atlanta traffic. But in some form, we are suffering. And if we find that if our relationship with suffering is that it shouldn't happen and we shouldn't suffer, and if we're suffering, we're somehow doing life wrong, then that really has an impact on how we experience the suffering that's just going to show up anyway. And so ACT is very intentional that we will suffer. And actually what we want to do is get really effective at suffering, get really good at opening up to what might happen, and really harnessing our energy and our resources to respond and relate in a healthy and effective ways to what's happening to us. And that suffering is actually sort of the universal experience, not and letting go of things that we may have less control over, like happiness, let's say. It's also intentionally focused on symptom management rather than symptom reduction. So in ACT, you won't find in any of the activities or even evaluation tools, anything about, has your anxiety reduced? Are you hearing fewer voices? Are you having fewer intrusive thoughts or compulsions? And instead, any whether it's any tools that you are using for processes or any evaluations that you might use to kind of track progress, are all about how someone is relating to what's happening to them. So the focus in all of these processes and all the skill building are around, how does someone manage what's happening to them in really healthy and effective ways, so that no matter what is happening, no matter how intense the suffering is, someone can always contextualize or know where they are in space in relation to that values guided life that they are both having access to today and are developing in an ongoing way for the future. Now, we all know that if someone is really making healthy and effective choices, that symptoms will go down, whatever those symptoms are. And we can talk about that pretty openly and readily with a client. But because we don't know when it's going to happen, how long it's going to take, and what exactly the mechanisms are that are going to do that, then we don't spend as much time on symptom reduction, because that's not where our control is. Our control is in the processes that we use to try to manage what's happening to us and how to relate to it in a more healthy and helpful way. As I mentioned before, throughout some of the processes, and similar to other mindfulness-based therapies, ACT takes a very formal, non-judgmental approach. So in any text that you read, you'll find the word curiosity coming up a lot. And that's this idea that whatever is happening to us, can we look at it with interest and curiosity? And to kind of almost squeeze as much juice out of it as we can. So again, since it's here anyway, it showed up, voices, sadness, fear, whatever it might be, can we be curious about what it is and what it might mean and not mean for us? Where this becomes really unique to ACT is in how we approach or how we engage with what's happening. So there really is, we are really moving away from language about any kind of dichotomous language, good, bad, right, wrong, true or false. And instead really focusing on this idea of helpful or unhelpful. And that helpful or unhelpful language is couched directly in that idea of a values guided life. Is regardless of, I'll use an example, like for my clients, many of them are experiencing delusions or hallucinations. This idea of true or false can be a place where people really get stuck. I need to know if this idea about the government tracking me or this camera in my eye, I need to know if that is true or not. And we can spend a lot of time there. And if anyone else has perhaps worked or served with people who are living with delusions such as these, you can understand where that feels really compelling to go down that road, and how there's always more information. So it makes it kind of an unwinnable conversation or unknowable answer anyway. But instead, the kind of conversations that we might have are, well, you've talked to me about this life that you want to have, even with, these thoughts that you have about the FBI or that camera that they may have put in your eye. And so I'm wondering if there's still a way to have that life that you've talked about. You've talked about connection is really important to you. You've talked about really wanting to feel accomplished. So finding some work or volunteering where you feel like you're doing something productive. And I'm wondering if we have to know the answer to that question about that camera in your eye in order for you to live this life that you want. And when that worry comes up, I wonder if we can give you some more choices about whether or not that moment is a good time to go down that road. to think about that, to explore that. There might be times you are curious about that and you want to try to do some research or you really want to reflect on it. But there might be other times where you say, you know what, I'm at work right now, and this doesn't really feel like a helpful time to think about that. So I'm going to table that until later, knowing that I'm not going to get the answer right in this moment. But right in this moment, what's important to me is doing really good at work because I like my job and I feel really good when I'm here. So really empowering people with a non-judgmental approach, which often offers more choices, and being able to sit in that discomfort of not knowing, but seeing power in the sort of helpful or unhelpful option that they might have. Now, of course, that example that I gave is with someone that I've been seeing for a while. We've really built up to that. That is not like a first session conversation necessarily that I would have with someone, but it is the place that we can help people get to live feeling a bit more comfortable with not knowing and uncertainty. So in that same vein is ACT is really intentional about how to let go of control of the things that we can't control, being really clear about the small amount of things or small group of things that we can control, and instead seeing power in choices. So though being really clarifying where we have control and where we don't, and within the area that we do control, really empowering that idea of choice. That I may not get to choose what's happening to me right now. That may not be where my control is, but I do get to choose how I respond to it, how I take care of myself, how much attention or focus I give this, or how much space it occupies in my attention or focus. ACT is very experiential. So I'm doing a lot of talking to you all today, right now, for this overview to both have an introduction for the next 3 sessions, but also for folks who are maybe only able to join today or kind of trying to decide if they're going to be able to attend the next 3 sessions, to just give an overview of sort of what the framework looks like. But in general, ACT is much more experiential. We spend a lot of time in role play, a lot of time using metaphors, a lot of time with sort of exposure in a way. So one of the questions that someone had asked in sort of the pre-session questions was how ACT relates to maybe exposure and response prevention. And it's actually very, very similar. So if you were already practicing exposure or ERP, you're essentially doing ACT in a little bit of a different way, but the principles are the same. Something is happening to you internally or externally that you can't control, and you're feeling compelled to respond in a certain way to feel better. And yet that sort of constellation of activities, the thoughts and the maybe compulsive responses, are not really adding much to a meaningful life, and instead are getting in the way. And so there's a lot of similarities. So we do a lot of exposure activities in ACT as well, although they may not be discussed or introduced in that same kind of like ERP frame. ACT also has a learner model. So you may have noticed today, as I'm talking, I'm sort of saying we. That's not necessarily purposeful for this session, but it is purposeful in that, or it's just kind of innate now. And that is the idea of ACT, is that if you're a clinician practicing it, you probably already buy into these things that are on this slide right here. This is probably already a way that you live your life, and that this is something that you kind of are already practicing yourselves. So even in ACT consultation groups, they encourage, and I'm part of an ACT consultation group, there is encouragement on working with your own stuff. There's actually less emphasis on like bringing in a case and talking about your case. Instead, it's about let's practice with our own stuff that we're going through, so we can both learn the skill, also feel what it's like to do an activity, like engage in a metaphor or engage in a role-playing exercise, and then use that information to help our clients engage in the exercise that we hope that they will learn and grow from. The other part of this learner model is that you actually can't get certified in ACT. You can be trained to be a trainer. And I will say I'm not a trainer. I'm a person that has used ACT almost exclusively for probably 7 or 8 years and attended several trainings, but I'm not a trainer myself. But there's probably only, I don't know how many trainers there are internationally, but not a ton relative to the number of clinicians that practice. But the idea is that there is no certification because you're always meant to be a learner, and this is always a practice. We're always experiencing new things. Our clients are always coming in with new things, and every activity can look a little different depending on the client or how the client is feeling that day. And so this idea that we're always practicing and there's no level of like certification or competency, I think is really important. And that also helps us think about that with our clients too. This idea we're always practicing, and we're always looking for opportunities to practice in life. Any questions about this and kind of how ACT relates to maybe other therapies or orientations? Yeah, someone mentioned liking the flexibility of ACT, and it seems helpful to folks coping with guilt and shame. It's really, really useful for many of those really insufferable internal experiences. Guilt and shame, certainly. I'll talk about this at the end, but since this comment got brought up, I guess a punchline is that ACT has a lot of evidence-based, is very evidence-based, and a lot of robust support for a number of different diagnoses, populations, age groups. So if you are kind of digging into the ACT literature, you'll see that there is a lot of evidence for using ACT across different kinds of experiences: couples, teens, family therapy, individual therapy, also settings, inpatient, outpatient, group, school. So this idea of flexibility that you're noticing, you might recognize like how you could use this for different populations and how you might be able to, I'm going to give some examples of activities here at the end today, but how you might be able to pull out some of these, ideas or tools in a sort of a standalone way, like the conversation of values, no matter what therapy you tend to practice, or no matter what your client is coming in with, helping someone figure out who they want to be in this world and what they want their life to stand for. What, in other ways, like what do you want your legacy to be in a way? Everybody could connect with that. And there might be a lot of people where no one's really asking that. A lot of my clients who are living with psychosis, people want to know about the frequency and intensity of their symptoms. They're not really thinking about how are we going to help you live a really full life with these experiences, and what do you want that to look like? I believe there's something more for you. What do you want that to be? And so those kinds of pieces of ACT, you can imagine kind of pulling them out and using them. Let's see. I see some more questions in here. Yeah, so this is on one of the final slides, but I'll go ahead and talk about it since it's here. It does have a lot of evidence base with a lot of different populations, but there are some situations where it may not be the most helpful. So, for example, folks who have cognitive impairments might struggle with some of the processes of ACT, like let's say the use of metaphors, or that observer self might be challenging. But most people could sit in the present moment and might be able to name where they feel tension in their body. Or when you're feeling this way right now, is there any place in your body that you're noticing any feelings? And that right there is mindfulness and present moment awareness. Just being able to first and even if the answer is no, I don't know anywhere in my body where that's happening, just even asking the question and inviting someone to consider that this content that I'm talking about, I might be able to anchor into it right now. And that might be a useful tool when I'm feeling upset or agitated or distressed, to be able to sort of slow down and just notice what's happening in my body or in my mind right now. So I think that's another really valuable component of ACT is it is sort of like a suite of options, but you don't have to be able to do every single thing with everyone. And you might actually choose, and there might be clients who are like, I don't do mindfulness. Okay, that's fine. I can also probably get you to practice mindfulness without you feeling like you're doing traditional meditation. But if you're not ready to do that right now, or that term like is you're not a fan of that term. Cool. We don't have to, we can get to present moment awareness through diffusion, through acceptance, through even values. And so there are lots of different ways to be flexible with these flexible processes. Let's see. Someone just asked about how what invited me to use ACT exclusively. I can just answer this really quickly. I was trained in a CBT program, and I had a client, and we happened to have one clinician in my training program who practiced MBSR, mindfulness-based stress reduction therapy. And so we had some different like tools in our clinic, because we had a community clinic that we operated out of. And I was stuck with a client one day and pulled off Get Out of Your Mind and Into Your Life, which is Stephen Hayes, one of the first ACT manuals. I didn't even know what it was. I just like grabbed it and started thumbing through it. And it's just full of some ideas of this framework, but also like activities. And I just started doing some of the activities with this client. And it just opened up, it like really freed us up from this rigidity. And I was able to see the level of rigidity and how stuck this person was in like thoughts and ideas. And from that point, I really just started kind of digging into ACT a little bit more here and there. And then now that I'm practicing on my own for the last 10 years or so, I just find it really just fits with how I think about suffering, how I think about what are the access points to progress for folks. And again, I see people who are living with, schizophrenia and first episode psychosis and bipolar disorders. And this is my primary orientation that I use for those folks, or use and find helpful for a variety of different reasons. All right. So if you're thinking about starting ACT, what are some of the things to think about? And I think I wanted to just say this really quickly because I think it is really interesting as part of the frame. Because some of you might be looking for tools to use today, and I wanted to make sure you have some of those. So one thing that's really interesting about ACT that's maybe different from how many of us were trained or practiced is it's much less focused on taking a history and much more focused on the here and now. So Russ Harris, who is one of the ACT trainers who I really value, I love reading his texts. I love he has all these free resources, which I'm giving you all the links to where to get all that good stuff. He talks a lot about just like, he doesn't do a history, and he is asking people, what's bringing you in now? What's not working in your life right now? And how would you like your life to be different? And this idea that history shows up in the present, like we will learn all the things about someone's history because it shows up in the present. And we might even be able to, in the present, inquire about history later on in our work with someone. So someone is finding themselves stuck, or we're noticing a narrative that's kind of replaying, even asking questions like, when was the first time you thought this about yourself? Have there been other times in your life where you recognize this feeling? And that can tell us a lot about the relevant parts of history, or the parts that are relevant for this person at this particular time. Because people might they're coming into our clinics and offices in different stages of difficulty. And 5 years ago, they may have gone in to see a therapist for one thing, and now they're coming in for something different. And so really being able to focus our attention on what parts of the history are relevant to what's happening to you now. Not to say that we're not just interested in history, that we like to learn the early stories and experiences of our clients. And also that we're not really wanting to know things like, have you had any hospitalizations? Do you have any trauma in your background? Do you have any suicide history with suicide? Those are things that we might just want to know. And in ACT, there's nothing about ACT that says do not ask a history. It's just an interesting way to think about how we enter into work with people and how we get started. And I'm actually going to show you one of the tools that Russ Harris uses as part of his intake that'll give you an idea about that. But just want to add a couple more components. It's also really focused on behavior change. This idea that the work that we're going to do together, change is going to happen, or you're going to get from where you are now to where you want to be, because changes are going to happen. So if you want life to be different, then you have to do different. So this blurb right here, I actually borrowed from Russ Harris in one of his many texts that he talked about using in his kind of intake information. And I find this really useful because it both helps someone from the beginning know that we're gonna act in here. So this is, the therapy is called ACT, but we're actually gonna act. We're gonna do things. And the doing of things is what's gonna help get you from where you are in this moment to where you want to be, even if you're not sure where that place is yet, both internally and perhaps even externally. It also starts experiential practice pretty early. So in a number of the ACT texts that we read, there is some discussion around like a metaphor that's used. So in this example, I like to use the guitar metaphor or some other relevant metaphor that's relevant to what someone has told me about themselves. Because I always ask people, tell me about yourself, what you enjoy. And so someone who might play instruments or they might cook. And so I might say, okay, let's imagine I was coming to you to learn to play the guitar. Like, how would you teach me to do that? How would I learn to play the guitar? And there's probably going to be a discussion around, well, you'd have to bring a guitar in, we'd practice chords. I'd give you things to practice over and over again. And then I might ask questions like, so you wouldn't just send me like a book to read, or I wouldn't just watch videos. Like I would actually have to pick up a guitar and play it. And through those kind of conversations, you can sort of say like, okay, so that sounds similar to what we'll be doing together. We'll be working on something or towards something that you really care about, just like I want to learn the guitar. And we're going to practice things probably over and over again, maybe more than you always want to, but knowing that doing that, underlying those practices are processes that are really important. They're going to help me just be more skilled, help you be more skilled the way that I would be more skilled. So knowing that underlying this practice are chords and our chord progressions and our ways that music fits together. And I'm going to build calluses and they might be painful. And sometimes I might want to give up and because I'm not seeing a lot of reward or output. But if I know that eventually I'd like to play a song on a guitar, I'm probably going to have to practice in a certain kind of way. And again, I'm summarizing this for us, but ideally I would have elicited all of this from the client in this sort of metaphor, and then it would just be summarizing from that. But I like to offer that so that client has a sense of like, oh, this is what we're doing together. This is how this might be different than therapy I've done before. Because I also want them to feel like they've got the choice and like, all right, I'm down with that. I think I'm open. I'm open to that now that I've sort of understand why action and why doing uncomfortable things might be important. This is called the Dissecting the Problem worksheet. This is that worksheet I was just alluding to a minute ago that Russ Harris, who's one of the trainers in ACT, talks about using in his intake. And this is actually available. I meant to have the link down there, but this is part of the, or you can see it in the footnote there. I'm going to give you the link to ACT Made Simple and all the free resources that come with that text. But this is what he talks about using in his intake. And so you can see here how really focused this is on, in one or two sentences, what would you describe as the main challenge? So it really helps people dial in on the biggest thing and not all the content that we could all imagine we get caught up in ourselves or that our clients might get caught up in. It's easy to get caught up in content and lose sight of what's the underlying, what is the main issue? Then it really asks about, what does this stop you from doing? So that's already like a values guided question. What does it stop you from doing? Already starts to get people thinking about what they'd like to be doing instead. And then these last four boxes are really connected to the different processes, the 6 processes that we've talked about, wanting to know from the beginning or wanting people to start thinking about what's happening that is maintaining this problem for you. What are the thoughts that are getting in the way? What are the activities that you're doing that are not helping you? Maybe you're using them to try to manage challenges, but either way, they are making your life more difficult in the long term. What are the things that you're avoiding to try to minimize your discomfort, but the avoidance might be keeping you from something that's meaningful? And what are the feelings that you're really struggling with? So this is a really present moment focused overview of what might be bringing someone in. And then of course, there's opportunity for history in you remember the first time that you thought this? Or do you remember how long you've been doing this and what was going on in your life when you started avoiding in this way, or when you started trying to cope in this way? Just an example of a different way to think about ACT. I've done this in an intake. I've also done this if a long-term client has come in with a new problem, let's say, or a new issue. We might use something like this to try to think about it in a different way. Because of time, I'm not going to talk about creative hopelessness, but this is one of the, I'll talk about briefly, but I'm not going to go in depth about it. But this is it's not one of the 6 core processes, because it's something you may or may not use depending on where a client is when they come into therapy. And it's akin to motivational interviewing. So if you've done motivational interviewing, then this is essentially creative hopelessness. But the reason it's part of ACT is because you might have some clients come in that are like, listen, I've got this problem. I've been working at it forever, and what I'm doing is just not working, and I'm ready for something new. In that case, you may not need for creative hopelessness, because someone is already at a place of acceptance saying, what I'm doing isn't working, so it's got to be something different, and I'm here for it. Creative hopelessness might come in when you've got a client that's entering therapy just wanting to be able to do the same thing, but more effectively. So it's actually opening up acceptance and willingness. Because someone who wants to come in just figuring out how to do the same thing that's not working may not be sort of open and willing to this flexible approach and these activities that are a part of ACT. So creative hopelessness is going to be part of any text that you might look at, and it's knowing it's something that a process that's available to you. It could be with a new client, or again, it could be with a client that you've been seeing, but you're noticing that they're stuck on something. This is a process that can be used. So it's really about opening up acceptance to new ways of doing things where someone is stuck. Here's a great activity around creative hopelessness. And you'll be getting these slides, and so there's some links here to all of these resources, and they're all free. So I'm just helping you giving you the links to get there a little bit more quickly. But this is how you might walk through creative hopelessness with someone as an activity. So again, ACT is less about explaining things and more about, I noticed that we're being stuck here, or that you're feeling stuck here and bumping up against this wall. I wonder if we could try something. And then you let the activity speak for itself. Also included here, I'll just give just offering is a case conceptualization form. So this is an ACT case conceptualization. So for those who like to practice case conceptualization, this is what it would look like from an ACT framework. You might do this just for yourself to sort of see where people are and where they might need help. So if you're noticing you've got a lot written down in the fusion section, that might tell you that cognitive diffusion techniques might be really helpful for this person. But also just keeps you thinking about where people are and what you've worked on and where things might be helpful. And so it's just another tool that we can use as clinicians. I've already talked about some of these considerations just a moment ago, but wanted to just make sure I'll go over them again here. We already talked about that there is a lot of evidence. So this is very much an evidence-based practice, and for both different issues, populations, and diagnoses, but also settings. And hopefully you can see how some of the flexibility, like you could take the dissecting the problem tool and use it for anyone and not really do a lot of other ACT process if you didn't want to. It could just be a tool that you use to think about what other factors might be at play and where people might feel stuck and what's not working. And again, it's ACT is about flexibility, but it is also a flexible process. And hopefully that's been clear today. It's not recommended for acute or severe episodes, as you might imagine. ACT is about a lot of reflection and observation, but if there's an acute situation, you use your safety planning, your risk assessments, those relapse prevention plans that we may all have for folks. And in that same vein, if there is a gold standard treatment for something, like, if you've got a client living with borderline personality disorder, use DBT. There's a lot of elements of DBT in ACT, but if you're feeling like there's something that really works, use that. This is more about opening up a way to think about things and adding in some different components, or you can buy fully into ACT as I have and find it to be really useful and flexible. So here are some of the resources. On my favorite resources you'll see here, I go to all the time. I either have the books or there are links to these online resources. Russ Harris, again, he's a trainer, makes much of his like the activities free. So all the things I've shown you today are free, and you can go on line to the links I've provided and find those. Act Mindfully is his website. On there is ACT Made Simple, which is a text, which is by far, in my view, the best ACT text if you want to just get an initial overview. But then he has some like extra components if you want more, and that's all on his website as well. And then the last thing I'll mention before we close up today is that if you also want to join, the international organization for ACT is the Association for Contextual and Behavioral Science, and it's a donation-based membership. And if you join, then you get access to international community and sharing of resources and listservs and questions, and I find it really helpful. So I've taken us right to the end, and I've tried to address all the questions in the chat, so hopefully there aren't too many more. If there are, you can always send me a message, and I know Stephanie has some questions for people as we finish up today, but I'm also happy to answer any questions if you want to send them my way in the chat, or I'll also put my email in the chat too. And hopefully you'll consider coming to the other 3 sessions where we'll break down the 6 components with activities and practicing together.
Great. Thank you so much, Dr. Waford. We really appreciate you taking us through the ACT framework and look forward to the other sessions. Just want to remind everyone that the next session is in 2 weeks, next Tuesday, January the 30th at 12 noon Eastern Time, focused on values and committed action. I just put a link in the chat as well. It's the SAMHSA required survey. So we do hope everyone takes a few minutes to fill out that survey and just give us feedback about the event. And we will also, we recorded this session and we will send along that link to the on-demand recording and the resources that Dr. Waford shared, and a follow-up email. Probably we'll get around to it tomorrow morning. So look for that email from info@southeastmhttc. Again, if you have questions for Dr. Waford, you can definitely email us back and we'll get those questions to her as well. So again, everyone, enjoy the rest of your afternoon, and we look forward to seeing you in 2 weeks. Take care.
Thanks, everyone. Take care. Thank you, Stephanie.
Thanks.